Have you ever noticed how a single headline can make your heart tighten before you even understand what it truly means? One of my patients once shared with me that the words high death rate stayed with her all night, even though she felt perfectly well. I want you to imagine this for a moment. Information arriving without context, and the body responding with worry before understanding has a chance to settle in. My name is Dr. Evelyn Carter, and I have spent many years caring for older adults and their families. Today, I want to talk with you calmly and honestly about the Nipah virus death rate. Not to alarm you, but to help you place this information where it belongs. Learning about a serious statistic does not mean danger is near. It means you are choosing awareness, and that choice is an act of self-respect. In my clinical experience, I've seen how quickly fear can rise when older adults hear phrases like, one of the highest death rates. Numbers without explanation can feel heavy, especially later in life when protecting peace of mind matters just as much as protecting the body. What many people do not realize is that statistics need context. A virus can have a high fatality rate without being common, widespread, or imminent. Understanding that difference changes how the body reacts. Even doctors are often surprised by Nipah virus statistics, not because the virus is everywhere, but because it behaves differently from illnesses we know well. It can affect the brain, the immune system, and the nervous system in ways that are unfamiliar. In older adults, changes in immunity and delayed symptom recognition can shape outcomes. None of this means you should live in fear. It means knowledge should be carried gently. This video is here to help you listen calmly. We will talk about what a death rate really means, why it can sound frightening without explanation, and how aging bodies respond differently to illness. In the next part, we will begin by placing these numbers into clear human context, so understanding can replace worry. If this feels helpful, I invite you to like this video, share it with someone you care about, and subscribe to Senior Health Daily. This channel exists to offer steady guidance and reassurance, so you never have to face health questions alone. Take a breath with me. You are safe here, and we will walk through this together, one calm step at a time. What a death rate really means. When people hear the words death rate, it can feel heavy all at once. I have watched shoulders tense and eyes grow quiet in my exam room the moment that phrase appears on a news screen. What I want to do here is slow that moment down and place it into clearer focus, especially for older adults who deserve understanding rather than alarm. A death rate is not a prediction about what will happen to you. It is a number created by looking backward, not forward. It is calculated by dividing the number of deaths by the number of confirmed cases in a specific setting and time. That means the number depends deeply on who was counted, where they were treated, and how early the illness was recognized. In rare diseases, this can be especially misleading. When only a small number of people are affected, and most of those cases are severe enough to reach hospitals, the percentage can appear much higher than the true risk in everyday life. I often explain this to my patients by comparing it to a quiet road that suddenly has one serious accident. If only a few cars have traveled that road, the statistics look frightening. That does not mean every car that passes will crash. It means the sample was small and the outcome was serious. Numbers tell part of a story, but they never tell the whole story. With Nipah virus, many reported cases come from outbreaks where people were already very ill by the time they received care. Early mild cases often go unnoticed or uncounted. That makes the death rate appear higher on paper. It also explains why doctors are sometimes surprised by the statistics. They reflect severity among known cases, not likelihood for the general population. For older adults, this distinction matters deeply. Hearing a high percentage without context can create unnecessary fear and tension. Anxiety itself affects sleep, memory, blood pressure, and emotional balance. Understanding how numbers are formed allows the nervous system to settle. It reminds the body that information is being offered for clarity, not for threat. I have cared for many seniors. who lived long and full lives because they learned to place medical information gently into context. They asked questions. They listened carefully. They allowed understanding to replace imagination. That approach protects dignity and emotional safety. When we understand that a death rate is a reflection of past circumstances rather than a personal forecast, something shifts. The mind opens. Curiosity replaces fear. This is the foundation we need before exploring anything further. Calm understanding gives us steadier ground, and from that place, we can continue learning with confidence and patience. Why Nipah virus affects the body so severely. To understand why Nipah virus can affect the body so deeply, it helps to think about how closely our systems work together, especially as we age. The body is not a collection of separate parts. It is a conversation between the lungs, the blood, the brain, and the immune system. When a virus enters that conversation, its impact depends not only on the virus itself, but on how the body responds. Nipah virus is known for its ability to move beyond one system. After entering the body, it can affect the respiratory system and the nervous system at the same time. This is one reason doctors take it seriously. When the lungs are involved, breathing can become more difficult, even if the early signs feel mild. Oxygen levels may shift subtly, which can affect energy, balance, and clarity of thought. In older adults, even small changes in oxygen can have a noticeable effect on how the brain feels and functions. What makes Nipah virus especially challenging is its connection to the brain. The brain is protected by layers designed to keep most infections out. Some viruses, however, can cross those protective boundaries. When the brain senses inflammation or stress, it may respond with confusion, sleepiness, or changes in mood before more obvious physical symptoms appear. For seniors, these changes can look like ordinary aging or existing memory concerns, which is why they are sometimes overlooked at first. From a simple scientific perspective, the immune system plays a central role. When the body recognizes an unfamiliar virus, it releases signals to rally its defenses. These signals travel through the bloodstream and affect multiple organs. In younger bodies, this response can be strong and fast. In older bodies, it is often slower and more complex. The immune system may take longer to recognize the threat, and when it does respond, the reaction can involve several systems at once. I have seen patients who felt fine in the morning and unusually drained by the afternoon. Not because the illness suddenly worsened, but because the body was working harder behind the scenes. This quiet strain can affect the heart, the lungs, and the brain together. That combination is what makes recovery more demanding, especially for those already living with chronic conditions. It is important to say this gently. Severe impact does not mean inevitable harm. It means the body needs time, support, and calm observation. Understanding how Nipah virus can involve multiple systems helps explain why doctors approach it with caution, and why early attention matters. When we look at the body as a whole, rather than focusing on one symptom, the picture becomes clearer. Knowledge replaces confusion, respect for the body grows, and seniors are better able to respond with patience and dignity, trusting that understanding is one of the strongest forms of care. The role of the brain and nervous system. When we talk about why certain illnesses carry greater risk, especially later in life, we must talk gently and honestly about the brain and the nervous system. These systems guide everything we do. They shape how we think, move, rest, and respond to the world. As we age, the brain remains remarkably adaptive, but it also becomes more sensitive to stress, inflammation, and sudden changes inside the body. One reason Nipah virus is taken so seriously is its ability to involve the brain. The brain is normally protected by a careful barrier that keeps most infections out. Some viruses, however, can disturb that balance. When the brain senses inflammation or immune stress, it often reacts early, sometimes before the body shows clear physical signs. This reaction may appear as confusion, deep fatigue, difficulty focusing, or changes in behavior. These are not dramatic symptoms, but they are meaningful ones. In older adults, Neurological involvement can increase risk because the brain is already working harder to maintain balance. Blood flow may be less flexible. Nerve signals may travel more slowly. Recovery from stress can take longer. When inflammation reaches the nervous system, even in a mild form, it can disrupt sleep, memory, and emotional regulation. These changes can affect daily routines and personal safety, which is why they matter so much. For individuals living with dementia or memory loss, this connection is especially important. The brain in dementia is already vulnerable to disruption. An illness that affects the nervous system can temporarily worsen confusion, agitation, or withdrawal. Families often tell me that a loved one seemed suddenly different, quieter, or more restless, even before anyone suspected an infection. These changes can feel frightening if they are not understood, but they are often signals of physical stress rather than permanent decline. From a caregiving perspective, the brain's response to illness reminds us why emotional safety is essential. Fear and overstimulation can intensify neurological symptoms. Calm voices, familiar routines, and gentle reassurance can help steady the nervous system while the body works to heal. This is not just comfort. It is supportive care for the brain itself. I have seen patients improve simply because their environment became calmer and their symptoms were recognized early. The nervous system responds to safety. When stress is reduced, sleep improves. When sleep improves, the brain recovers more effectively. These small supports can make a meaningful difference. Understanding the role of the brain does not mean expecting the worst. It means listening carefully to subtle changes and responding with patience. For seniors and caregivers, recognizing neurological signals as part of the body's communication allows for earlier support and tender care. It honors dignity and preserves trust in the body's ability to adapt, even during moments of uncertainty. Aging and immune response. As we grow older, the immune system does not disappear or fail. It changes its rhythm. I like to describe it as a system that has learned efficiency through experience. Instead of reacting quickly and loudly, it often responds more slowly and thoughtfully. This shift is not a weakness. It is an adaptation shaped by decades of protecting the body through many seasons of life. In younger bodies, the immune response tends to be fast and intense. Fever rises quickly. Inflammation signals are strong. The body announces that it is fighting something. In older adults, the response is often quieter. Fever may be mild or absent. Inflammation may develop gradually. The body still recognizes a threat, but it speaks in a softer voice. This difference can affect outcomes, not because the immune system is incapable, but because the signals are less obvious and sometimes delayed. With viruses that place stress on multiple systems, timing matters. When the immune response unfolds more slowly, it can take longer for the body to fully contain the illness. During that time, other organs may feel the strain. Energy levels drop. Balance may feel unsteady. Thinking can become slower or foggier. These effects are not signs that the body is losing control. They are signs that it is working steadily behind the scenes. I often remind older patients that their immune systems have already done something remarkable. They have learned tolerance. They know how to avoid overreaction. Inflammation that is too intense can be harmful, especially to the brain and blood vessels. A calmer immune response can actually protect tissues from damage. The challenge comes when quiet signals are overlooked or dismissed, delaying supportive care that could help the body recover more smoothly. Chronic conditions can also shape immune responses. Diabetes, heart disease, lung conditions, and autoimmune disorders all influence how the immune system behaves. Medications can add another layer. None of this means aging bodies are fragile. It means they are complex. Complexity requires patience and understanding rather than urgency. From a caregiving perspective, this is why early observation matters. Supporting the immune system does not always mean aggressive treatment. Often, it means rest, hydration, nutrition, and monitoring. It means maintaining routines that support sleep and emotional balance. It means checking in gently rather than pushing the body to perform. I have seen many seniors recover well because their bodies were given time and calm support. When stress is reduced, the immune system functions more effectively. When fear is replaced by understanding, the nervous system settles and healing becomes easier. Aging does not strip the body of strength. It refines it. When we respect how the immune system changes with time, we make space for better outcomes. We allow the body to do what it has learned to do over a lifetime. Respond wisely, protect what matters, and move forward with patience and dignity. Why early symptoms are often missed. Early symptoms are often missed not because people are inattentive, but because the body is subtle and life is full. I have seen this many times in my practice. An older adult notices a change, but it feels small. A little more tired than usual, a mild headache that comes and goes, less appetite for a day or two. These signs blend easily into daily routines, especially when someone is already managing arthritis, heart disease, diabetes, or memory concerns. One reason early signs are overlooked is familiarity. When symptoms resemble things we have felt before, the mind naturally tries to explain them away. Fatigue becomes a poor night of sleep. Dizziness becomes dehydration. A foggy morning becomes age or stress. Seniors are often thoughtful and patient with their bodies. They wait. Waiting is not careless. It is a habit formed by years of knowing that many things pass on their own. There are also practical challenges in medical care. Appointments are often brief, and doctors must begin with what is most common. Medications can cause side effects that look like illness. Chronic conditions can fluctuate and mimic new problems. When early symptoms are mild and nonspecific, it is reasonable for clinicians to observe before testing aggressively. This careful approach protects patients from unnecessary procedures and anxiety, but it can also mean that time passes before a pattern becomes clear. Patterns are the key. Illness rarely announces itself in a single moment. It reveals itself over days. When early signs are scattered and quiet, it takes patience to connect them. A slight fever one day, extra sleep the next, a missed meal later in the week. Each moment alone seems unimportant. Together, they tell a story. Without careful listening, that story can be delayed. For older adults living with cognitive changes, this challenge is even greater. Someone with memory loss may not notice or report symptoms clearly. Instead, changes show up in behavior. Less conversation, more restlessness, missed medications. Caregivers may attribute these changes to dementia progression rather than physical stress. Without context, the body's message can be misunderstood. I often encourage families to trust gentle observation, not fear, but attention. Notice what is different from the usual pattern. Notice what persists. Share those observations calmly with a healthcare provider. Clear descriptions over time are far more helpful than urgency without detail. Missing early symptoms is not a failure. It is a reflection of how quietly the body speaks and how complex aging can be. When we accept that reality, we stop blaming ourselves or others. We focus instead on learning how to listen better. That patience protects dignity. It reduces panic, and it gives the body and the care team the time they need to respond wisely. Staying informed together. One of the most healing things I have witnessed over the years is what happens when people learn together. Health feels less heavy when it is shared in a calm and steady way. Older adults often tell me that simply understanding what is happening in their bodies brings relief. Caregivers tell me that having clear language helps them feel less alone. When information is offered with patience and respect, it becomes a form of care in itself. Staying informed does not mean watching every headline or chasing every new concern. It means choosing a steady source and returning to it when questions arise. Routine matters for emotional safety. Familiar voices and consistent guidance help the nervous system settle. This is especially important for seniors and for families caring for someone with memory changes. When information arrives calmly and predictably, it is easier to absorb and easier to trust. I think often about the quiet moments when people watch these videos. A morning cup of coffee, a late evening after a long day of caregiving. These moments are not about urgency, they are about reassurance. Learning together allows questions to unfold at a human pace. It allows understanding to replace worry and connection to replace isolation. Community also shapes how we respond to uncertainty. When people share what they have learned, others feel permission to ask questions. When caregivers hear that small changes matter, they feel supported in noticing patterns without fear. This shared understanding protects dignity. It reminds us that caring for health is not a solo effort. It is a partnership built on listening and patience. Before we continue, if this video is helping you understand your health, please subscribe, like, and share Senior Health Daily. It gives us the motivation to create more life-saving content for you. That simple act of staying connected helps this space reach others who may need calm guidance just as much as you do. Sharing is not about promotion. It is about extending care. It allows thoughtful information to travel gently from one household to another, offering reassurance where it is needed most. Senior Health Daily exists as a shared caregiving space, a place to return when questions surface, when routines feel disrupted, or when reassurance matters more than answers. There is no pressure here, only continuity. As we stay informed together, we strengthen not just our knowledge, but our sense of steadiness. And in that steadiness, health feels more manageable and far less lonely. Why? Older adults face higher complication risks. As we grow older, the body becomes a careful manager of its resources. It has learned how to balance energy, protect vital organs, and recover in measured steps. This wisdom serves us well in daily life, but it also explains why complications can arise more easily when illness places extra demands on the system. I want to speak about this with compassion, because higher risk does not mean inevitable harm. It means the body needs more support and more time. Many older adults live with more than one health condition: heart disease, diabetes, lung conditions, kidney concerns, arthritis, and memory changes often exist together. These conditions are not failures. They are chapters in a long life. When an infection enters the picture, the body must divide its attention. Energy that usually supports movement, digestion, or clear thinking is redirected toward healing. With several conditions already drawing on that energy, reserves can feel thinner. Recovery challenges are also shaped by routine. Sleep may already be lighter. Appetite may fluctuate. Muscles may lose strength more quickly with rest. When illness interrupts daily patterns, the body can feel disoriented. I have seen patients who recovered physically, yet felt unsteady emotionally because their routines were disrupted. Restoring rhythm is part of recovery, and it often takes longer later in life. Energy reserves matter in quiet ways. Younger bodies can push through stress and rebound quickly. Older bodies are more honest. They ask for rest sooner. They signal fatigue earlier. This is not weakness. It is communication. When those signals are respected, outcomes are often better. When they are ignored, strain can build and complications can follow. For those living with dementia or cognitive changes, the picture becomes more delicate. Illness can temporarily worsen confusion or agitation, even if the physical symptoms seem mild. This can increase the risk of falls, missed medications, or withdrawal from eating and drinking. Caregivers often notice these changes first. Their observations are a vital part of care, and they deserve trust and support. I have watched many older adults recover well when their care focused on steadiness rather than speed. Hydration was prioritized. Sleep was protected. Familiar routines were gently reintroduced. Family and caregivers worked together with clinicians, sharing observations calmly. These small acts add up. They conserve energy and reduce complications. Understanding higher risk is not meant to create worry. It is meant to guide kindness. When we acknowledge comorbidities, recovery needs, and energy reserves, we respond more wisely. We slow down. We listen. We give the body what it asks for. In doing so, we honor dignity and support healing in a way that fits the life already being lived. What doctors watch for. When clinicians assess illness, especially in older adults, they are rarely focused on a single symptom. Medicine at this stage of life is about patterns, timing, and change. I often explain to patients that severity reveals itself over time, not in one isolated moment. A headache alone does not tell a story. Neither does fatigue or a low-grade fever. What matters is how these signals move together and whether they shift the body away from its usual balance. Doctors begin by anchoring to your baseline. What is normal for you matters more than textbook definitions. We listen for changes in energy, appetite, sleep, thinking, and mobility. We ask how long those changes have lasted and whether they are steady, improving, or quietly progressing. A symptom that eases with rest is different from one that deepens across days. That distinction guides care. We also watch how systems interact. Breathing that feels slightly labored can affect sleep and attention. Subtle drops in hydration can influence blood pressure and clarity. Mild confusion can increase fall risk. None of these alone define severity, but together they can. This is why clinicians return to the same questions at follow-up visits. The goal is not repetition, it is comparison. In older adults, the absence of dramatic signs does not guarantee safety. Fever may be muted, pain may be understated. Instead, we pay attention to function. Are daily tasks becoming harder? Is walking less steady? Are medications being taken differently? Is the person withdrawing from conversation or activities they usually enjoy? These functional changes often tell us more than numbers on a chart. Time is a diagnostic tool. Watchful waiting is not passive. It is active observation with clear checkpoints. We look for trajectories. Is the body adapting or struggling? Is rest restoring or only postponing fatigue? Are supports helping or are new needs emerging? This approach protects patients from unnecessary interventions while allowing timely action when patterns become clear. For those living with dementia, clinicians rely heavily on caregiver observations. A new agitation, a shift in sleep rhythm, or a change in appetite may signal physical stress before any complaint is voiced. Caregivers become partners in assessment, offering continuity that brief appointments cannot provide. I want you to know that careful assessment is an act of respect. It honors complexity. It avoids rushing to conclusions that can create anxiety or harm. When doctors watch for patterns over time, they are listening to the body's full story. This way of care supports dignity. It keeps decisions grounded and calm. And it reminds us that health is not judged by one symptom, but by how the whole person is doing, day by day, with patience and attention. Calm decision-making. During health uncertainty can be unsettling, especially later in life when stability and routine matter so much. I have seen how quickly worry can grow when answers are not immediate. The mind fills gaps with imagination, and the body responds with tension. Calm decision-making begins by recognizing that uncertainty does not require urgency. It requires steadiness. Panic-driven choices often come from a desire to regain control. When fear rises, people may rush to tests, change medications abruptly, or search endlessly for reassurance. These actions can exhaust the body and overwhelm the nervous system. They can also disrupt routines that quietly support healing. Calm choices, by contrast, protect energy and preserve clarity. One of the most helpful practices is to slow the pace of decisions. Take a breath. Allow information to arrive fully. Ask what has changed over time, rather than what feels alarming in one moment. When decisions are made after rest and reflection, they tend to be kinder and more accurate. This is especially important for seniors, whose bodies respond best to consistency. Emotional safety is not a luxury. It is a clinical need. Anxiety affects sleep, appetite, blood pressure, and attention. It can worsen confusion and increase fall risk. For those living with memory changes, fear can quickly amplify agitation or withdrawal. Creating a calm environment helps the brain feel safe enough to function. Simple actions matter. Keeping familiar routines. Limiting distressing news. Choosing one trusted source of guidance. Speaking gently with yourself and with those who care for you. I often encourage patients and families to name what they know and what they do not know. Clarity reduces fear. Saying we are watching this and we will reassess in 2 days gives the mind a plan. It replaces endless vigilance with a clear next step. Calm decision-making also means asking for help. Sharing concerns with a clinician, a family member, or a caregiver allows decisions to be made together rather than in isolation. For caregivers, calm leadership is powerful. When you move slowly and speak with reassurance, the person you care for often mirrors that steadiness. This is not about hiding information. It is about delivering it in a way the nervous system can receive. Uncertainty does not mean danger is near. It means the body is communicating and time is part of the answer. When we choose calm over haste, we protect dignity and preserve trust in ourselves. We give the body space to show its direction. Calm decisions honor a lifetime of experience. They keep fear from becoming the loudest voice in the room. And they allow health to be approached as a partnership grounded in patience, clarity, and care. Understanding risk. Without living in fear. As we come to the final part of this deeper conversation, I want to gently shift how we hold the word risk. For many older adults, risk can feel like a warning sign, something to watch closely or brace against. Over time, that way of thinking can quietly turn into vigilance, and vigilance can become exhausting. What I want to offer instead is a different frame. Awareness is not about watching for danger. It is about understanding your body well enough to live with confidence. Risk exists in every stage of life. What changes with age is not the presence of risk, but how we relate to it. When awareness is grounded in calm understanding, it becomes empowering. It allows you to notice changes without jumping to conclusions. It gives you permission to pause rather than react. This is especially important for seniors because peace of mind directly supports physical and cognitive health. I have cared for many older adults who lived fully because they learned to hold information lightly. They understood their health conditions, but they did not let those conditions define their days. They listened to their bodies, respected their limits, and trusted patterns rather than isolated moments. This approach reduced anxiety and preserved energy, which in turn supported recovery and resilience. Living in fear narrows life. It pulls attention away from routine, connection, and rest. It can increase stress hormones that interfere with sleep, memory, and immune function. Living with understanding does the opposite. It widens perspective. It allows you to make thoughtful choices without urgency. It reminds you that most health decisions are not emergencies, but conversations that unfold over time. For those caring for someone with dementia, this perspective is essential. Constant vigilance can create tension that the brain senses immediately. Calm awareness creates safety. When caregivers respond to changes with patience rather than alarm, the person they care for often feels steadier. This steadiness protects dignity and preserves trust, even during uncertain moments. Understanding risk also means recognizing what you can control and what you cannot. You can support your body with rest, nourishment, hydration, and routine. You can communicate clearly with healthcare providers. You can choose reliable sources of information. What you do not need to control is every outcome. Letting go of that burden is a form of self-care. I often tell patients that wisdom in aging is not about avoiding all risk. It is about knowing when to act and when to allow time to do its work. Awareness guides you. Fear drains you. When awareness leads, decisions feel calmer and more aligned with who you are. As we close this section, I want you to carry one gentle truth with you. Learning about health is not an invitation to worry. It is an invitation to trust yourself more deeply. Senior Health Daily exists to support that trust, a steady place you can return to when questions arise, without pressure or urgency. If it feels right, I invite you to stay connected. We will continue walking this path together with clarity, patience, and respect for the life you are living now. As we come to the end of our time together, I want to slow everything down and invite you to take a gentle breath. Learning about high death rates can sound frightening at first, but knowledge does not mean danger is close. It means you chose to understand rather than imagine, and that choice brings steadiness back into the body. Over many decades, your body has carried you through seasons of change, stress, recovery, and growth. It has adapted in quiet ways that deserve respect. Even now, it continues to work for you, adjusting and protecting, often without asking for attention. There is wisdom in that resilience, and there is wisdom in the life experience that allows you to listen more carefully than ever before. Awareness is not something that takes peace away. It is a form of dignity. When you learn with calm curiosity, you honor the body you live in. Patience becomes a kind of protection, allowing time to reveal what truly matters. Calm becomes strength, helping the nervous system settle so the mind can think clearly and the body can rest when rest is needed. Health is never a battle to be won. It is a partnership that unfolds slowly between the body, the mind, the people who care for you, and the passage of time itself. When that partnership is built on trust rather than fear, decisions feel lighter and more humane. You do not need to control every outcome. You only need to stay present, attentive, and kind to yourself. If there is one feeling I hope you carry with you after this video, it is reassurance. You are not behind. You are not fragile. You are living in a body that has learned how to endure and adapt. Senior Health Daily exists for moments like this. A steady place you can return to when questions surface or when you simply want to feel understood. There is no urgency here. Only continuity, care, and connection. If it feels right, I invite you to stay connected with us as you continue aging with confidence, patience, and grace.